Hello, this is still the continuation of Introduction in Nursing Research, still on types of research and on the methodological foundations, specifically the quantitative researches. We are now on the non-experimental designs. So earlier we talked about the experimental designs. This time it is the non-experimental designs. To continue, so there are different non-experimental designs. One is your descriptive. So when I talk about descriptive designs, we are referring to a specific type of research which would describe the phenomenon or a certain event as it occurred during the time of the study. Example, you have your univariate descriptive. When I talk about univariate descriptive, that would mean that your focus is one variable. You tried to focus on a single variable. When I talk about descriptive correlational, okay, you are trying to correlate between two or several variables. Okay, just to elucidate, an example would be if I want to determine the infection control practices of nurses in a private hospital in Iloilo, that is univariate descriptive. But if I would want to know the relationship between the socioeconomic status and the intent to have consultations among the residents in a certain barangay in Iloilo, that would be descriptive correlational because I am looking at their socioeconomic status. That's one variable. And then the second variable is their intent to have their consultation. So that's descriptive correlational. Your descriptive studies could range from having surveys up to census. So when I talk about census, it deals with the entire population. Let's say, for example, I would want to know the incidence of malnutrition or feeding problems in a certain population. It could be a census study because it would involve everybody in the population. Then you will have your sample survey. So when I say sample, a certain part of a population which is chosen to represent the population. You refer to that one as your sample studies. So for example, if I randomly pick 100 children out of the 2,000 in Barangay X, that could be referred to as a sample survey. The number of the sample size is determined, okay, by a computation. Later on, we'll know about that. Then you have your correlational studies. So I've mentioned this in the earlier slide. When I talk about correlation, it indicates to what extent one variable, in this case x, is related to another variable, which could be represented as y. Commonly, you will hear studies about knowledge, attitude, and practices. Knowledge, attitude, and practices studies are usually correlational studies because they would want to correlate if the level of knowledge would be related to the level of attitude or attitude towards a certain substance, okay, and then their practices related to this. So this is a test actually, okay, of the theory on knowledge acquisition that checks whether all of the knowledge that we had will lead to practices. So you have the correlational studies. It tries to check the relationship between two variables. Then you have your retrospective studies. When I talk about retrospective studies, these are your ex post facto or after the fact studies. What do I mean by that? For example, I am conducting a study right now, and then this study is about the experiences of the people in the past. Let's say I would want to know if the platelet levels of a patient who had dengue 3 weeks ago is still occurring up to the present. So a study from the past going towards the present is a retrospective study. That's why it's referred to as ex post facto. When I say ex post facto, after the fact, meaning the event is already done, I just would want to check if what is the quantity of this event. Retrospective. If retrospective is into the past events, your prospective is looking into the future events. The focus of your prospective studies is the future. Meaning I will do an intervention, for example, today, and I will be checking what happens after 5 days, 10, and even 15 days, for that matter. That is prospective study. Research can also be categorized based on time dimension. So we have your cross-sectional study and longitudinal study. When I talk about cross-sectional study, these are studies which are conducted in a single period of time and concerns several groups of individuals. An example would be, I would want to know the academic performance of student nurses, level 1, level 2, level 3, and level 4 in 2021 online classes. If you can notice, I am trying to capture level 1, 2, 3, and 4 in 2021. It's a cross-sectional study. I would want to study several sections but in a single period of time. When I talk about longitudinal study, I am trying to look into the trend. I am trying to look into the changes of a group across period of time. Okay, across a long period of time. Longitudinal. Okay, that's why the term is longitudinal. For example, I would want to know the lived experiences, I would want to know the academic performance of BSN batch 2024 when they were first year, second year, third year, and fourth year. I am observing the same group of students from first year, second year, third year, and fourth year. In other words, I would want to compare, is there a relationship? Is there a difference on their performance from first year to second year to third year to fourth year? It's a longitudinal study. It's a long study. Now, there are two types of your longitudinal study. When I talk about cohort studies, when I say cohort, it concerns itself with groups. When I talk about trend studies, it concerns itself with trends. Okay, I hope that this will help you differentiate cross-sectional and longitudinal research. Now, qualitative research designs. There are several qualitative research designs. Allow me to walk you through the 5 most common qualitative research designs that are commonly used. So 1 is your phenomenology. You have your ethnography, you have your grounded theory, you have your case study, and then you have your narrative analysis, or other authors would say narrative inquiry. Let's talk about your characteristics of the 5 qualitative approaches. So this is pulled out from the book of Creswell on qualitative researches. Now, let's talk about the focus. When I talk about narrative research, it would like to explore the life of an individual. Okay, they use questions to explore the life of an individual. In phenomenology, we would want to understand the essence of the experience. Oftentimes, we would say the lived experience of patients with cancer, the lived experience of individuals in online classes, okay, especially pregnant mothers or pregnant students in online classes, for example. When I talk about grounded theory, I would want to develop a theory grounded in data from the field. So when I explore a certain phenomenon, I don't just stop by saying the phenomenon can be described as this and that. Instead, grounded theory would answer the question, how come this phenomenon occurred? What are the predisposing? What are the factors that could have led to this phenomenon? Or how come this phenomenon has developed? That's the concern of your grounded theory. When I talk about ethnography, an ethnographic study is concerned on describing and interpreting a culture sharing group. So it's concerned with a specific culture. And this specific culture could be a group of Eta, it could be a group of Tibuli, it could be an ethnic group in the mountain province, it could be a group of people who are living together with shared experiences and shared culture, norm, and values. A culture, or ethnography. Then when I talk about case study, its focus is developing an in-depth description and analysis of a case or multiple cases. For example, I would want to know a case study on a specific blood disorder, which is unique, for example, in an Iloilo setting. Or I would want to conduct a case study on the efficacy of the program of organization A. I will be able to use case study as an approach. And in case study, it could be a single case or multiple cases. An example of a single case would be to focus on the characteristics of a certain organization. And when I talk about multiple cases, I might be talking about case studies on diseases. So what are the types of problems that are best suited for each of these design? A narrative research is best used if I need to tell a story of individual experiences. Let's say, for example, I would want to know the narrative experience of a Bukot. Okay, if you know Bukot, they are princesses, okay, from far-flung areas, and then they were placed on Bukot. Okay, they were placed on a certain type of captivity for them to be protected from the outside society. So I would want to know their individual experiences. A phenomenon you need to describe the essence of a lived phenomenon. An example would be, I would want to know the experience of those people who had diabetes and then they gone blind. What happened? What are their lived experiences? What is the phenomenon behind it? A grounded theory, on the other hand, is related to having a theory in the view of the participants. I am not giving the participants the idea how come they are anxious during an OR event, how come that they would have this reaction whenever they are exposed to a certain condition. Instead, it will be the participants that will try to explain how come they are reacting like this. And then ethnography, you would want to describe and interpret the shared patterns of a culture in a group. Why are the health practices of this group of ethnic people is this that? What's happening? What are the factors? And your case study is to provide an in-depth understanding of an interesting case. If you would look at the next table, they are differentiated based on the unit of analysis and then data collection forms. Okay? Try to pause the video presentation and try to analyze the difference between the different types of qualitative researches, when it comes to unit of analysis and data collection form. You can notice that the unit of analysis is more concerned of an individual, one or more individuals or individuals with shared experiences, several individuals, individuals belonging from the same culture, or it could be an event, a program, an activity with more than one individual. The spectrum of the unit of analysis varies, and the number of which would vary depending on data saturation and theoretical saturation. When I say data saturation, dear students, for example, in phenomenology, when I talk about data saturation, it is characterized by the presence of no new emerging themes. Again, there are no new emerging themes, which means that when I am doing my interview to a certain participant, I am not getting any new ideas anymore. It's as if that there are no new emerging themes, no new emerging concepts, no new emerging lived experiences to be shared. For example, in doing an interview 1, I learned this. I had these lived experiences. Interview 2, I transcribed, I list the lived experiences and then the meanings. Interview 3, 4, 5, okay, there are experiences, there are meanings. Interview 6, it's as if that interviewer or interviewee 6 or participant 6 is saying the same thing like in participant 1 to 5. So my tendency as a researcher is, let's go to participant 7 and let's try to confirm, are there new emerging themes? Once I interviewed participant 7 and then I've noticed, there's no new emerging themes. It's the same lived experience that are being shared by the previous 5 and 6. So there I can say that there is data saturation. That would signal the end of data collection in phenomenology. Okay, that's how it works in qualitative researches. Unlike in quantitative researches, wherein we usually have a predetermined number, okay, we have a predetermined number of participants, okay, by sampling, we have a predetermined number of participants through determination of sample size. Okay, so that's how it's varied. So try to look into this. Okay, common to the 5 is interviews, and we are trying to analyze the richness, the depthness of the data through the interviews. And what do we do with the interview? We transcribe the interview. When I say transcribe, you type all the things that you talk about there, and then read, reread, analyze, reanalyze until you are able to get the meaning of those words that you have gotten from your respondents or participants. Again, I would like to reiterate that the term respondent is more appropriate in a quantitative research, whereas the term participant is more appropriate in a qualitative research. Then the data analysis strategy. Okay, so here, try to pause again and look at how each of these data are analyzed. Okay, and try to pause and look into how the written report is made. Okay, so you are encountering term chronology, meaning you would arrange the words or you would arrange the statements in chronological order. In phenomenology, you are looking into the essence of the phenomenon. What is the phenomenon as they have experienced it? In grounded theory, you're looking into open coding, eggshell coding, and selective coding. Whereas in ethnography, you would want the analysis of the culture, related themes. And then in case study, you analyze the data through description of the cases. Whereas a written report would be focused on individual, here the essence of the experience, the theory using a figure, and then describing a culture, and then developing a case report in the case of your case study. So you have the 5 research there. Now, let's talk about the mixed methods research design. Mixed method. It's neither quanti nor quali. It's a combination of your quantitative and qualitative researches. Sir, is this type of design recommended in the graduate school level, master's or doctoral level? The type of research design is not just congruent to your educational pursuit, but the type of research design should be inclined on what type of research or what problem are you trying to address. There are studies wherein quantitative researches would be the best method to be used. There are studies wherein qualitative researches are best to be used. And there are studies wherein mixed method research design is the most appropriate. To give you an overview, when I talk about mixed method research design, so you have the 3 types according to Creswell. 1, you have your convergent parallel mixed methods. 2, you have your explanatory sequential mixed methods. 3, you have your exploratory sequential mixed methods. Let's reorient. Convergent parallel mixed method. They're done at the same time. Your quantitative and qualitative are done at the same time. Explanatory sequential. Explanatory, I gather the quantitative part first, I do the quantitative part, and then I'll proceed to the qualitative research. Exploratory, I do the qualitative part first, and then I'll make the quantitative part. Now, how does that work? I'll go back to explanatory sequential mixed method. I'll have, for example, a study compliance, or let's say, for example, family planning practices among families in barangay X during COVID-19 pandemic. And then, for example, I found out, oops, use of condom decrease. Oops, compliance to pills have been decreasing. Oops, there have been a lot of pregnancies in this barangay. Those can be my findings in quantitative research. Now, I am interested to know, how come this is happening? What's happening in this barangay? And a way for me to explain that further, explanatory, explain it further, is to conduct a qualitative research. I'll be doing an interview. Ma'am, it came out in the results that there is a decrease in the compliance in the use of pills. What's happening? That's why our quantitative part is intended to explain the quantitative component of the research. Next, you have your exploratory sequential mixed method. In an exploratory sequential mixed method, the qualitative component, is done first. For example, an interview was done. What are the lived experiences of single parent fathers? The fathers who act as single parents. And then I found out that they would say there's anxiety, there is, for example, problem in child rearing, there is problem on how to make the milk or how to prepare food product. If that's the qualitative result, my quantitative will be, what is the level of anxiety of these fathers? Or what is the knowledge about child rearing among these fathers? That's the purpose of your exploratory sequential mixed methods. So quali first and then quantitative component. Now, let us reiterate on the characteristics of a nurse researcher. 1. There should be intellectual curiosity. When I say intellectual curiosity, you would want to answer the question what, who, why, and how. You need to be curious. Why is this specific phenomenon? Why is this specific problem occurring? Second, there should be creative thinking. When I say creative thinking, you should be thinking outside of the box and you should see that there is a different perspective in each of the problem. Critical thinking. As a critical thinker, we do not stop by saying there is a problem, but instead we ask, what is the reason behind this problem? Next, ability to relate our study to a known theory. So if there are existing theories, we are not supposed to create new theories. Instead, we should try to relate our study to a known theory and test this theory. Can we revise the theory? If we found out that there is some concern with theory, with a series of researches, we can be able to recommend for the revision of the theory. But if you have a genuine idea, okay, that is unique with all other existing theories, you can also pursue that research. But most of the researchers right now would already have a known theory to which you can anchor it to. Next, patience and discipline to see the study through. It is not possible just for you to say, I'll conduct research. It's tiring, I want to stop doing research. It's not like that. When you conduct research, you need to see yourself that you will see through the process until it's done. You are not conducting research just for the purpose of requirement in the academe. You are not conducting research just for the purpose that you'll be earning money, but we are supposed to conduct research because we are curious and we want to answer a certain problem. Next, patience and discipline. Other than that, intellectual honesty. Okay? Intellectual honesty. Numbers don't lie. Research methods don't lie. But the person that is doing the statistics, the person who is understanding the research could lie. So you should have the intellectual honesty. When I say intellectual honesty, do not try to conceal. Do not try to hide the true meaning of your research by using words that are not familiar to the readers. Do not make them think that intervention A might be effective because according to this study. Do not make them think like that. Instead, you should make them think that there might be something that your study can recommend without conceding to them the truth. You don't need to hide them. Okay? You don't need to say, oh no, my study is not significant. Not because your study is not statistically significant, it would not have a clinical significance. Again, I would like to re-emphasize that clinical significance is different from statistical significance. It does not mean that if the study would have no significant difference on the result, it would appear to have no clinical significance. There's always a clinical significance. And then a sense of humor. Okay? There's a time for that. Okay? There's a time for a sense of humor. A sense of humor, according to authors, could usually help us to communicate our findings to others. Okay, but you need to use your sense of humor judiciously. Because remember, you are in academic pursuit. You are in a serious scientific pursuit. It's not supposed to be a joke on the part of your participants, respondents, and then your co-researchers. The research problem. We've been talking about the research problem from the start, hence a reiteration. The nature of the research problem in the variables. So you need to have the ability to identify the researchable problem. It's the most difficult step in the research process. If you can recall the words of Albert Einstein, he would say that defining the problem would solve half of the problem. Okay? Not his exact words, but you can search on that. A discrepancy or gap between what is and what should be. Again, when I say research problem, it is a discrepancy between what is and what should be. When I say what is, what's happening? What's the current situation? What's the problem? What's the concern? And when I say what should be, when I talk about what should be, what could have been the ideal situation? What could have been a way for us to address this problem? So any discrepancy between these two is a researchable problem. A simple way of saying it is that I am depressed. That is what is. What should be? I should be happy. There's a problem between the two. Although that may be a dramatic example, but I hope that will help you remember what is and what should be. What is compliance on family planning practices have decreased, or the contraceptive prevalence rate has decreased. What should be, even in the time of pandemic, the programs for family planning must continue, because pandemic is another problem. Family planning is another problem by itself that needs to be addressed. So there are a lot of what is and what should be's in our surroundings. Try to discern more of this so that you'll have a good research problem. Next, the problem is the question or difficulty that the study seeks to solve. Okay? Then the purpose refers to the outcome, number one being intended. Intended outcome is nothing else than the solution of the problem itself. I would like to repeat that. The intended outcome is nothing else than the solution of the problem itself. So this definition differentiates between the problem, the purpose, and then you have your intended outcome. Problem. It's the question that the study seeks to solve. Why is it that the family planning practices have decreased? Purpose. I would want to identify the factors related to the family planning practices. Intended outcome. If I found out later on that, okay, their knowledge in family planning would have a problem, then I would be able to know I need to give them something to enhance their knowledge. Okay, that's your intended outcome. So what are our guideposts in determining the researchability of a problem? How can we say that a problem that you're thinking is indeed researchable? 1. No available answers to explain. I don't know. You don't know. Nobody knows what's happening. Available solutions are not known or untested. So I might be saying that I want to investigate on malunggay extracts. Are these malunggay extracts investigated on? Are its effects already investigated by research? Possible results, there are a lot, but they are contradictory. There are several possible explanations. Why is it happening? And then the phenomenon exists tracks which require clarifications or explanation. There are several explanations whether there might be a solution, but then the solution is still vague. I still need an explanation. Next, what are the possible sources of problem? Field of specialization personnel and professional experts and interest. Instructional programs could be one. The reading programs, the literature sources, and then previous research studies. What were the findings of these research that we could use, or that is still vague, or that needs to be clarified? Or according to the results of their study, what could be further investigated on? Next, organizational structure, policies, and interpersonal relationships. And then the existence of new technologies. So what are the new technologies available to us? Are they beneficial? What are the new modes of learning available to us? Are they really helpful, or are they not helping at all? So these are some problem sources. Next, conflicting ideas and ideals. Okay, what's your idea and what's supposed to be ideal about it? Journal books, thesis, or dissertations, and mass media. Even the theories and principles affecting the certain phenomena. Is the theory of unitary human being by Martha Rogers still up to date? Or is it still applicable at present? Is the self-care deficit theory by Dorothea Orem still applicable at present? Then problem, situation, and issues, and then suggestions of experts and authorities. Oftentimes your experts and authorities, because of their experience, could easily identify the problem. And they could be a good source because they are experts in their field. They are able to know what is and what should be. They're able to know what is already existent in terms of their literature in their specific research, and they're able to discern if it needs study or not. These are some areas of consideration for your sources of problem. So, what is our criteria for choosing the research problem? I said there are a lot of research problems. Why is your proposal get approved? Why does a proposal denied? What's our basis for that? One, you have your external criteria. Later on, we'll have the internal criteria. When I say external criteria, this would involve significance or novelty of a problem. How new is the problem? Okay, is it an existing or prevailing problem? Is it worth studying? because there might be a problem. However, this problem is in the past and not anymore significant. Next, problem researchability. Is it researchable? Is it manageable? Could you define the problem specifically in such a way that I will be able to discern what do you want to investigate on? And can the problem be subjected to empirical testing to identify the specific variables and determine the relationship of these variables? Okay, so it tells us, is it measurable? Is it observable? Can empirical testing be done? Next, the feasibility of the problem. Time frame. Availability of the subjects. Are there administrative control and support groups that need to be considered? What are the research resources? What are the fiscal resources? Financial resources, in other words. What's the capability of the researcher? Is there a financing institution, a funding institution, or will the researcher be doing this on her own? What is the capability of the researcher when it comes to educational qualifications? Is there somebody who could supervise the researchers or the novice researchers or the beginning researchers? And is it ethical? If this is an experimental research, are there already animal studies which would demonstrate that the medication being developed would pose minimal risk to humans? Because we cannot proceed to human studies without preliminary studies on animals. Or will there be harm on the respondents? If there is a given harm or predicted harm to the respondents, will the harm be outweighed by benefits? Because if not, better not pursue the research. Internal criteria. Is this motivated, or can this motivate the researcher in terms of intellectual curiosity and perceptiveness? Is the researcher really curious, or did just somebody pay him to go on this research? Are you experienced, or do you have the professional qualifications? How about time management? And then how about cost and returns? Okay, is there an income? Is there a financing or funding institution that you need to consider? And what are the possible hazards, penalties, and handicaps that are associated with this kind of research? These are, or this will be your considerations. Okay, your internal criteria. Now be able to differentiate whether the criteria is internal or external. If it is an external criteria, it needs to be addressed by interagency relationship. It needs to be addressed by the researcher by seeking outside sources. But internal criteria is more on the part of the researcher. It's more of contemplation on the part of the researcher. I would like to thank you for your attention in this lecture. I hope that you have learned something and see you in the next lecture. Thank you and God bless.